Hello, my name is Javier Parga, and I'm the project manager for the National Hispanic and Latino Mental Health Technology Transfer Center. Carlos and I will be conducting this webinar on bullying.
Okay, so the objective of our webinar is we're gonna be providing some relevant information for service providers. We wish that this information can prove helpful and provide practical tools in understanding how to define and work with the problem of bullying in schools, specifically with Hispanic and Latino children and youth. So we're going to be talking about prevention strategies, management strategies that have demonstrated to be effective. And also we're going to be talking about the role of culture in what is bullying and how to prevent bullying. So we are going to meet our objectives by defining what is bullying and also identifying some of the short-term and long-term impacts of bullying in their victims, and recognize also, like I said, the role of culture and the cultural elements, how they can sometimes either increase or reduce the psychosocial impact of bullying in their victims. And we also want to discuss some culturally appropriate interventions that can help prevent and manage its occurrence and impact. So let's ask ourselves for a minute, what is bullying? Well, there's many definitions of bullying, and in essence, bullying is an aggression that has the conscious intent to cause some type of emotional response on the victim that places that victim under the control of the bully. Also, bullying is a behavior that is repetitive over time, so that the bully manages to exercise that control and manipulation is an issue of power over the victim. So the behavior comes from the desire to cause fear, distress, and harm. And there's always a real or perceived power imbalance between the bully and the victim. Let's go ahead and take a look at the definition that the CDC has for bullying. Any unwanted aggressive behavior by another youth or group of youth who are not siblings or current dating partners that involves an observed or perceived power imbalance and is repeated multiple times or is highly likely to be repeated. Now let's look at some numbers about bullying. School bullying statistic with Hispanic and Latino populations show us that about 70.2% of Hispanic students report being bullied at school. This is a very significant number when we consider the whole population of Hispanic children and youth in the United States. 17.2% of Hispanic students report being bullied. Also, Latino parents have listed bullying as their #1 children's health concern, according to research. And they are 57% more concerned with bullying than other kids' parents from other groups. So again, these are very relevant numbers when it comes to understanding the impact of bullying in children and adolescents' health, emotional health. At least 26% of Hispanic students live in fear of being subjected to peer abuse. 26%, that is a very high number, almost 1/4. And as far as prevention programs, 25% of school-based bullying prevention programs have proven to decrease bullying up to 25%. So let's look at what forms bullying can take.
There are four major types of bullying: physical, verbal, psychological, and cyberbullying. Physical bullying is when the victim is hit, punched, or physically abused in any way. This form of bullying can leave physical marks, but it is not always so. The next type of bullying is verbal. It can take the form of name calling, teasing, or being the subject of jokes affecting the individual's self worth. Psychological or relational bullying can be so subtle that for many who are not part of the bully victim relationship will not be obvious. Spreading rumors, excluding the victim from being a part of group activities or social functions can be a form of psychological bullying. And the last form is cyberbullying, which refers to threats, humiliations, or stalking that occur through social media. We will examine this specific topic in a few minutes. Even when bullying is defined as an act of aggression, as it often occurs with many forms of violence, it is really about control. The bully is being aggressive to assert his or her personal power over another person. There is satisfaction in the feeling of power and control that represents hurting another individual. Being aware of this will result in a more focused management and prevention when we try to deal with it. Bullying does not occur between evenly matched opponents. The bully is capable of projecting an image of superiority that allows the situation to continue. If this projection is lost, control is lost. And it's very important that we are aware that on some occasions there is physical or psychological superiority, but on many occasions it's just a projection of that image that has an impact on the other individual. Being able to physically hurt others is one of the most common power sources. It often is due to being superior in size, strength, or physical capability. The next one, being numerically superior, such as a group of three individuals ganging up on one individual, is another power source. Being more confident and assertive than others, which can propel someone to directly make fun of another individual without worrying how that will influence themselves or their reputation. Another form of power source for the bully is having superior social or manipulation skills, which can provide the ability to turn people against someone or have them excluded. Having greater social status and the ability to influence others or access to embarrassing or private information is another source of power for the bully. Being able to sophisticately threaten or hurt others, such as making fun of someone in a subtle way that goes unnoticed by adults in schools, which allows the bullying to continue. Let's see what cyberbullying is all about. Carlos?
Okay, let's talk about cyberbullying, which is a very serious issue that takes place amongst teenagers. It's a form of bullying that takes place on social networks, and this phenomenon is known as cyberbullying. And it can take place over digital devices like cell phones, computers, or tablets. And it can also occur through text messages, apps, social media online, forums, chats, gamings. Teenagers today, when they play games, they connect with each other, they can interact, so cyberbullying can happen there too. So it includes sending, posting, or sharing negative, harmful, false, or mean content about someone else. It can also include sharing personal or private information about someone else, causing embarrassment and humiliation. So one of the main problems with cyberbullying is humiliation and making ridicule of others. And since it can spread so fast, it can really have extremely negative effects in the emotional health of teenagers and adolescents. And there's even sometimes it crosses the line of unlawful or criminal behavior. So we know that there's many laws that are being passed now to regulate behavior online. So let's look at some of the forms of cyberbullying. We have harassment, humiliation, flaming, impersonation, cyberstalking, and outing. So all these forms of cyberbullying represent a major threat to the well-being, to the emotional well-being of an adolescent or a young children. And parents and teachers should be very aware of this because it can really have a strong negative effects. Let's look at some of the numbers about cyberbullying. So among school students, 15.5% have reported being cyberbullied, and 20.2% are bullied in school property. And from 2007 to 2016, percentages of individuals who have experienced cyberbullying have nearly doubled. So this is a major concern. 90% of teens who report being cyberbullied have also been bullied offline. So this means that these are children and adolescents who are being bullied at school physically, and then they also experience the form of cyberbullying, which is gonna make it even worse, creating some serious mental health issues. 23% of students who were cyberbullied notified an adult at school about the incident. So this is a really small number, 23%. They reported it to an adult. So it brings us to the importance of raising awareness to children and youth to really communicate when they're experiencing some type of form of cyberbullying. 40 to 50% of the targets are aware of the identity of the perpetrator. So again, it's a small number in terms of the adolescents who are being cyberbullied. Only almost half of them know who their perpetrator is. The other half cannot even identify who is doing the harassment or the attacks online. So victims cannot stop cyberbullying by just turning away from the computer or turning off the computer. It stays with them, and this is the reason why it's so severe. It really affects their self-esteem. So the effects of bullying have been widely documented, and there's many research that has been done around the negative effect that it has on emotional well-being. So there's research shows that there's an increased risk of poor school adjustments, sleep difficulties, anxiety, and depression. And also there's a negative effect in self-esteem, the way that victims feel about themselves. 19% report that their relationship with friends and family and on their school and work is affected. Also, victims are twice as likely to experience negative health effects such as headaches and stomach aches. So there's many reports of nurses in schools with children or teenagers coming to, asking for help about, they're feeling a headache or some physical manifestations, and it turns out that they're being bullied, so they're somatizing some of those effects. So youth who self-blame and conclude they deserve to be bullied are more likely to face negative outcomes such as depression, prolonged victimization, and maladjustment. So again, research shows that victims of bullying can have develop really negative self-esteem. Students who are both targets of bullying and engage in bullying behavior are at greater risk for both mental health and behavior problems than students who only bully or are bullied. So we have here the problem of, some adolescents who are bullies, they are also being victims of bullying, and this population is at a higher risk of developing mental health and behavioral problems. Now I'm gonna allow Javier to elaborate a little bit on bullying and suicide.
Thank you. Suicide has been identified as the most extreme consequence of bullying since the very initial descriptions of the phenomenon. However, we should be aware that depression, expressions of anger and violent behavior, and substance abuse, including alcohol use, are mediators of suicidal behavior and therefore should be identified as risk factors, should be assessed and addressed as needed. Suicide ideas can be very frequent consequences of bullying. If we can identify these precursors, we can be able to take early actions to reduce the risk of suicidal thoughts and suicidal attempts on the part of victims of bullying. Another relevant factor to be considered is when an individual is a bully and is also the victim of bullying. On many occasions, we have the belief that you are either or a bully or a victim of bullying. However, many bullies were at one point victims of bullying, and on many occasions you can have both occurring at the same time. Such a situation has been related to a higher risk for suicidal behavior. So another item which we should be looking for is how often the individual which we identified either as a victim or as a bully have also been in the other side of the coin, and how that must be addressed through preventive or treatment interventions. Research has demonstrated that students who are victims of bullying are twice as likely to have suicide ideas and to actually attempt suicide. Thoughts of suicide were between 2.3 and 8 times higher for Latino students who felt low levels of connectedness and communications with their families. Students who are both victims of bullying and who are bullies are the highest risk group for adverse outcomes. Suicide-related behavior is not always at the same time related to being bullied. We have to be aware that suicide behavior, ideas, plans, and acts are not a natural response or a natural consequence to being the victim of bullying. Not all persons who are bullied go on to plan, think, or even attempt suicide. The risk of thinking that this occurs all the time is that we can normalize the response and therefore create what is called copycat behavior among youth. So even though we need to address and assess the risk of suicide for individuals who are bullies or being bullied, we cannot treat everyone as if they were victims going to commit suicide in one way or another. Carlos, what are the most common factors affecting Hispanic and Latino youth and children in their communities?
Okay, so this is a very important aspect of our presentation, because if we are to take a close look at the problem of bullying inside schools and how it affects Hispanic and Latino youth and children, we must begin at analyzing the way that community stressors are linked to Latino kids' depression and other mental health issues. So research has identified what are the major stressors that boys and girls have pinpointed. And as far as boys, they've identified racism and discrimination, racial profiling, gang activity, substance abuse, and violence as the major stressors that they see in their lives as part of a community. As far as girls, they have identified discrimination, immigration, issues related to family, and problems at school with peers as their major stressors. It's also important for us to talk about acculturation, because if we are going to understand the context in which Latino and Hispanic children and adolescents are developing, we have to understand the issue of acculturation, which is defined as the bidimensional process by which Latino youth acquires aspects of the dominant receiving U.S. culture, while also selectively learning or maintaining aspects of their Latino heritage. So they are dealing with adapting to the main culture of the United States, a culture to which they are adapting, having to incorporate, and also struggling with the aspect of keeping their own heritage, their own traditions, their own culture. So there's sometimes a clash there between those two, and that's it's called acculturation, that process of adaptation. So Latino immigrant youth are frequently forced to shoulder significant burdens from early childhood to late adolescence and beyond. So to a greater degree than the majority of their non-immigrant, non-Latino peers, these children and teens are in high risk in categories which are physically, academically, socially, emotionally, financially, and environmentally. Therefore, there's many risk factors as far as depression. So the experiences that accompany the process of acculturation, such as discrimination, bullying, victimization, social support, and perceptions of a positive school climate, they lead to higher or lower depression risks. So it's very important we take this in consideration. Let's look at some of the protective factors regarding culture. So a lot of research suggests that Latino cultural values play a strong role in allowing immigrant youth to develop forces that can help them as far as dealing with the stressors that they have to face. So cultural aspects can serve as protective factors and can help them in coping with the difficult experiences that they encounter as immigrants. And this brings us to the aspect of clinical correlations. So research also shows us that the acquisition and or the adherence to US cultural elements, therefore acquiring and adapting to the main culture in the United States versus the clash that can happen, sometimes is related with elevated risk for depressions, where in the other hand, retention or acquisition of their own Latino cultural elements might be associated with lower risk. So what we're talking about here is that some of these cultural aspects represent a strong protective factor. And we're going to look now at some of these traditional values. Familismo, respeto, personalismo, collectivismo, religion, and spirituality. And let's take a look at those a little bit further. So familismo is a strong cultural value, and it basically prioritizes the unity of the family. So young Latinos are able to establish a very special support network that is a very strong protective factor, and it really allows them to have that support network in their families, and it prevents risk behavior, it prevents substance abuse, and it'll help them to make the right decisions in life. So this is a very important aspect. Respeto, respect, is another strong Latino cultural value, and it basically means that there's a respect for elders, there's respect for aunties, and there's respect for those members of the community that can, serve as support, even as active participants and consultants in the process of, developing strategies for transforming the challenges into opportunities for growth and positive change. So this is a value that will allow teenagers to seek help and seek the role model of other family members, elders in the community, and it'll help them cope with the challenges that they face. We have personalism, you might say in English, and it's another aspect of many Latino cultures in the United States, and it really allows for an ability to establish meaningful relationship with teachers or mentors or therapists, providing an emotional support that goes a little beyond the formal interactions that you would expect from a professional relationship. So at times, the way this serves as a protective factor is that counselors, teachers, other school personnel can really establish a really strong bond with a teenager, and this will be a source of support. And then we have collectivismo, which is like an altruistic value that's very present in many Latino families, and it promotes the development of traditional values, and this in turn is going to nourish a sense of purpose, a sense of a higher calling. And for teenagers, this plays an important role because it will not only help with their self-esteem, but it also gives them a sense of belonging, which is a strong protective factor and is a very critical aspect, the sense of belonging, because if they're dealing with acculturation, this is a value that would allow them to have that, feel that they're rooted to a community. And then we have religion and spirituality, religión and espiritualidad. You know, most Hispanic and Latino families, you know, religion and spirituality plays an important role in their lives. So in many ways, it allows for an alternative view of different challenges, emotional challenges that they might be experiencing. And it allows for a collaborative approach as another protective factor. So these values are present in a lot of other cultures, but we mention them and provide information of how it looks in the Hispanic and Latino children and youth. So now let's look at how bullying particularly affects Hispanic and Latino children, and what are some of the elements that make Hispanic and Latino children more prone to being bullied at school.
Thank you, Carlos. Some of the impact of bullying on Hispanic and Latino children and youth is the development of fear and anxiety related to race, loneliness due to marginalization and isolation, low self-esteem, feeling shame for your culture, and hopelessness and despair. Race-related bullying is significantly associated with negative emotional and physical health effects. In a study of more than 7,000 predominantly Black and Latino middle and high school students, Peskin and colleagues found that victims of bullying reported frequent worries, sadness, nervousness, and fearfulness. Research has identified differences in the content and focus of the bullying when the victim is of a different ethnic or racial background, where the bullying is directed at skin color and other physical traits, language, food, clothing, and other racial or ethnic characteristics. Research and theory suggests that immigrant youth are often marginalized and experience discrimination, ridicule, and rejection by native-born peers, and may be at a higher risk for bullying victimization due to both direct and indirect factors. Marginalization and isolation are frequently identified as risk factors for various negative psychological maladaptive behaviors, which can include substance use, establishing risky behaviors, including risky sexual behaviors. A well-documented consequence of bullying is the negative impact it has on self-esteem. Victims of bullying are made to feel that they are not valuable individuals. Again, decreased self-esteem will in turn translate into a decreased performance on school and social activities. Individuals with low self-esteem will have lower motivation for most activities that are part of daily living. An important negative effect of bullying is the impact on the value attributed to the culture of origin. Many Hispanic and Latino children and youth are adapting to a new culture in the United States, even if they are second or third generation citizens. Their culture of origin is frequently a source of pride and unity to family and friends. Seeing this source of support and personal meaning affected by bullying has a huge impact on self-image and in turn in the support that these values provide. And last on our list is hopelessness and despair. Continuous bullying can create a feeling of despair, having an impact on our vision of the future. With the loss of a positive future, the individual will experience low motivation to most of life activities. One last note before we move on. Adults often do not believe that bullying is a real threat to the mental and physical health of the victim. This is a serious issue that needs to be addressed, since in many Hispanic communities, the expected response to a bully can be to confront him or her. If a victim of bullying seeks help from an adult, one thing we need to promote is that adults recognize and validate the occurrence of bullying, and then they move on to assess the situation. Carlos?
Yes, we're going to talk about evidence-based practices that have been identified as effective in terms of developing prevention programs. And research has shown that there are 6 major frameworks: ecological systems, which are approaches that deal with developing a multi-layer approach into educating and establishing a culture of prevention, a culture of zero tolerance. Social learning, which is aimed at cultivating an environment where there is the ability to enhance social skills in children and adolescents and strengthen those social skills, and also teach them ways to relate in a healthy way. We have cognitive behavioral approaches, which have proven to be very effective as far as dealing with victims of bullying. Many times, a victim of bullying will develop a negative self-talk, which will in turn create a habitual pattern of thinking negatively about themselves. So cognitive behavioral therapies have proven very effective in helping adolescents and victims of bullying to deal with those ideas, and then preventing from behaviors that could end up in self-harm. Attribution is an approach that aims at teaching people to understand the causes of the bullying behavior, also to understand the causes of the ways that a victim responds. So by attribution, students and teenagers can learn how to understand why a bully is doing bullying and how they can respond in the proper way to protect themselves and put an end to the abuse. Lifestyle exposure it's an approach that deals with exposing students to different alternative lifestyles that are healthier than maybe the environments in which they are used to being around. So exposing students to different activities where they can develop their own abilities, it'll help them to establish a better self-esteem. They can become more self-confident. And then resilience is another approach that has proven very effective. Resilience is defined as the ability to spring back, to rebound and successfully cope with challenges. And it's proven to be very helpful also as far as coping with bullying victimization. So resilience is fostered with supporting environments, positive peer relationships, and also a sense of belonging. So this is another strong way to deal with the problem of bullying. Javier?
Let's look at some of the activities we need to have in mind to prevent bullying at school. The very first one is to assess the situation. Basing your plan on data, basing your plan on the bullying activities that you have identified, or the risk factors to bullying that you can identify, should be the first step in being able to establish a well strategized plan. Second, consider a multi-tiered intervention. Prevention of bullying in school needs to be a multi-component effort that addresses multiple aspects of bullying behavior and the environment that supports it. Examples can include examining school rules, using behavior management techniques and social emotional learning in the classrooms, and throughout the school to detect and provide information on the consequences on bullying. Being able to establish activities and interventions that will be directed at the primary prevention, secondary prevention, and tertiary prevention levels is very important. Primary prevention strategies should be strategies that address the prevention of the occurrence of bullying and should be directed at all members of the school community, students, faculty, and administrator. Secondary interventions should be interventions that are targeting individuals who uh, have done bullying behavior, had demonstrated bullying behavior, and bullying victims to prevent it from continuing and to decrease the risk of negative consequences of it. And tertiary preventive strategies should be those that are directed at managing the consequences of bullying or being bullied. Next, identify school personnel and individuals from the community that can work on a prevention and management plan that will include family, will include faculty, administrators, and students. Make sure your plan is responsive to the values of the school and the values of the community in which that school is set. Consider, first of all, evidence-based practices, or EBPs. EBPs are strategies that have proven to be effective and that there's scientific literature that lets you know how to implement them in order to assure their effectiveness. However, there are not enough EBPs to cover all possible situations. So one thing we should consider is what are called evidence-informed strategies. If the situation you want to deal with is not addressed by an EBP, this planning group can sit down and examine what the evidence suggests are the best ways of dealing with or preventing bullying in your school. Based on that information, then that team and other professionals can sit and work on a plan that is based on what scientific evidence indicates. Now going into specific prevention of bullying in school. First of all, consider mental health promotion strategies. Promoting mental health from the start of the education needs to be a key component of all school planning. It needs to be directed at every level of school activities and be based on stages of development. It should clearly establish what the standards are and the expectations for behavior within the school. The next item is to promote a positive school climate. School climate implies being clear on the standards for safety in school, rules of functioning in school, relations in school, how to address and how to report events that should be taken into consideration and should be changed. School administration is firstly responsible for assuring that a good school climate occurs, not only in the academic, from the academic perspective, but also in the social, sports, relational, and community levels. Positive discipline practices are practices that are based more on providing support for good behavior, and they begin by setting school-wide expectations about positive behaviors, establishing routines, training the staff on how to promote and reward positive behavior, and involving families in the community. Disseminate the school's policies on bullying. Make sure everybody is aware of them. Help families understand what they can do to support good mental health in their children at home. The next item is mental health literacy. Mental health literacy is the knowledge and beliefs about mental health disorders that aid in their recognition, management, and prevention. Education on mental health literacy helps students to understand how to obtain and maintain good mental health. It promotes understanding of mental disorders and their treatment, therefore reducing stigma and increasing help-seeking efficacy. And last but not least is social and emotional learning. Social and emotional learning are interventions directed at improving social skills and emotional intelligence. There are many different activities that can be worked into the academic program between kindergarten through high school to ensure that students develop not only uh, learning skills, but also the capacity to be effective in establishing relationships, understanding what good and bad relationships are, and learning how to deal with them. Carlos?
Okay, now let's consider some cultural elements also in what Javier was just talking about. So seeking peer support. Yeah, I think it's very important that we teach children and adolescents how to properly seek support from their own friends. You know, at times a child or an adolescent will be experiencing bullying, and maybe they don't speak out, they don't tell their friends. So it's important that we teach them to seek that peer support. Also, as far as the school, it's important to involve families from the beginning. We know that the participation of families in school activities at times is challenging for administrators and faculty. However, you know, having the families involved and asking for their collaboration in activities and special projects can be a way of mitigating the effects of bullying and also preventing it. And then cultural values to identify and validate sources of support. I think that brings us back to respeto, familismo. So we can, you know, we can support ourselves as providers in some of those cultural values to help children and teenagers find that support, that source of support in their families, in their communities. And also identifying adults as sources of support. Here we would be connecting to personalismo. Sometimes children and adolescents, they have a reference to that value, and this can be helpful in teaching them to seek that support from any trust, you know, any adult that they trust, and they can identify it as a source of support. And then it's also important supporting the victim. So it is crucial that we provide a space, a safe space where we can listen to what the victim has been experiencing, and we can validate their experience, their pain, and also, you know, assess the emotional consequences so that we can teach them about the emotional consequences of being a victim of bullying. Therefore, we can address the importance of exercising boundaries. They can learn how to put an end to that behavior that they're being a victim of. And then also to address the bullying behavior. You know, we talk about the victim a lot, but we also need to address the bully, because the bully in a way is also a victim. And we need to address that behavior. We need to address whatever it is that it's causing that child or adolescent to you know, engage in that sort of negative behavior. Individual counseling or psychotherapy. Some schools have psychologists, therapists, or clinical social workers. Cognitive behavioral therapy has proven to be very effective. So seeking out that support from, you know, the professional who is assigned at that school. And family therapy can also be helpful in engaging the family and breaking the taboo, because at times children or adolescents who experience bullying, they feel that sometimes they feel ashamed of what's happening. They don't want to speak about it. For some reason, they might feel that they're doing something wrong, and that's why this is happening. So family therapy can really help to break that cycle of silence, that cycle of a secret, and allow family to be a part of the healing process for children and adolescents. And then promote, you know, how can we promote behavior change with the bullies again, right? Because we have to address the bully also. And there's many ways that we can address that and break those patterns. You know, first of all, we need to teach them how to change the way that they use their power. So kids who bully need to help develop problem-solving skills. that doesn't necessarily involve aggression. So it's important to provide them with opportunities to use their natural leadership skills in a positive way. For example, to teach them how to, a sports or a new skill. So we need to help kids who bully to resist the peer pressure, right? Of just let them know that they can really make a change in their behavior. They don't have to be abiding by other, the pressure they feel from others. So also acknowledging positive behaviors, encouraging positive connections among children by praising respectful and cooperative behavior whenever it happens. So we need to try and focus on the positive behavior of all students, even when they need to be corrected. So children are work in progress. They can't always get it all right. So they just need to learn through trial and error, and this is okay. So bullies need to understand this, and it might help them to get rid of that negative behavior. And then teach them about consequences, not so much punishment. So children who bully need help in understanding the impact of their actions. So formative consequences are designed to send a message that bullying is just unacceptable, while also providing support to understand that they need to develop social skills of empathy that maybe they're lacking. So, you can have students create like a poster, a collage, or a drawing of what it must feel like to be bullied. Talk about the feelings that children who are bullied might experience, like shame, embarrassment, anger, fear, or sadness. Also, you could assign students a research project where they have to learn about prevalence, nature, and consequences of bullying. Maybe write a paper or create a class presentation based on their findings. These are all ways that we can educate that bully. And have the students who bully also interview an adult or an older student about their bullying experiences and the impact it had on him and her. Again, being a victim of bullying is a problem that can continue throughout their adult life. So assigning a project requires students who bully to research like historical figures or celebrities who have been bullied, and this can be very informative. You can also have students read a novel about bullying or write a character study. Have them watch a movie about bullying and describe the characters and then the consequences of their actions. Encourage them to focus on their feelings, on the feelings of the victimized, so that they can identify these feelings, and they can even start learning how to identify facial expressions, body posture, tone of voice. All these things can help them to be aware of their negative behavior. And also, you can have your students identify instances of bullying in the media, like television, newspapers, radio, magazines. And, have them talk openly about, what they're seeing and the reaction to this. So keeping that open communication about the topic is the main source of prevention, and it's a way that we can help end that cycle. So we can teach appropriate outlets for anger, and then they can learn how to engage in cooperative and nurturing ways. And as a result of this is going to increase self-esteem, both in the bully and in the victim of bullying. So thank you for your participation. We are very hopeful that this has been a useful presentation for all of you, that you can take this information into your personal lives. If you work with children and adolescents from the Latino and Hispanic population, we're sure that this will give you some tools and some information that is going to be helpful in dealing with this serious problem.
Thank you, Carlos, and thanks everyone for being patient. We had a couple of technical difficulties at the beginning, but we have a couple of questions. The first one would be, let me see, I have a couple. Do you have recommendations for parents and schools to work together in addressing bullying behavior?
I think a good way to address that would be organizing like a conversatory or a workshop where both parents and teachers could participate and have an open conversation. Like I said earlier, I mean, sometimes the bullying, it's like a taboo. So victims of bullying sometimes feel ashamed of what they're going through. So it's very important that we can establish some platforms where we can have open discussions, and it doesn't have to be a taboo anymore. So that's something that could be helpful, like organizing an activity, a conversatory, watching a movie and discussing it, or a workshop, invite somebody, a professional who can do a presentation and open that discussion, and have teachers, parents, and students interact with each other about the topic. That would be a good way to address that.
Okay, perfect. The next question says, what are your thoughts on moving away from EBPs, or perhaps reframing these approaches to focus more on helping clients reclaim those cultural values that are significant to Latino communities?
As we mentioned during the webinar, there are not enough EBPs for every particular population sector. So on many occasions, you will find that an EBP that functions, helps a particular cultural group or a particular ethnic group or a minority is not exactly applicable to another one when used in the same way that it was created. There are forms of adapting an EBP that are usually part of how to use the EBP itself. So there are, on many occasions, instructions on how you can adapt that to another population. However, not every EBP can be adapted to other populations. So one theme you will find recently is what is called evidence-informed practices. Not only evidence-based practices, but evidence-informed practices. And that refers to the adaptations you make of an evidence-based practice to make it work for another population segment or another community that has not been considered as the target population of the original EBP. So I would invite all of the participants to consider learning more on evidence-informed practices and thinking on how we can adapt those evidence-based practices that are available to make them more responsive to a particular cultural or community needs.
Javier, I want to add to that there's, as I was doing the literature review for this presentation, there's a researcher, Farrington and Tofty, they came up with, they recognized that there's not a lot of EBPs that are specifically designed to work with bullying. So what they say is that there seems to be based, common sense ideas about what works in preventing bullying is sometimes the approach. So there's many times where you just have to use common sense and come up with your own ways of dealing with the problem, of course with the backup of research and other therapeutic approaches. But it's a very valid question, because in fact it is like an issue that researchers find.
Okay, perfect. The next question says, applies the prevention of equal bullying with children and youth with disabilities? I guess it means, how do we apply this prevention techniques, but with children and youth with disabilities?
That's a whole other area of bullying when the target is a person with disabilities. And going back to the common sense aspect of it, there's many things for example, what we have discussed today that would definitely apply to that scenario. But we definitely need to take a more close look at the type of bullying when the target is a person with a disability, because it definitely has a different tone to it. It's a different kind of aggression. I think in a way it's more severe, because it's really taking advantage of a person with disability. In that sense, I think school administrators, teachers, and school personnel in general, those they have to be much more involved if there's an issue related to bullying to a population with disabilities, because that in itself is a phenomenon that I think will be a sign of even some sort of pathology from the part of the bully who is targeting a person with disabilities. Somehow it seems there's a lot of cruelty involved in doing something like that. So the answer to your question will be yes. In a way, all these approaches will be helpful, but there will have to be a deeper look at the problem and definitely address it because it's a very important aspect that needs to be addressed too.
Okay, so our last question for the day, and if we didn't answer your question, you can write to our email and we'll make sure the presenters answer any other questions that we receive. And the last question is, are there specific interventions for bullying of children who identify as LGBTQ? For instance, addressing the bullying in addition to supporting them as they become aware and empowered in their sexual identity.
I would have to almost repeat some of the things that Carlos just said. There are forms of bullying that take, even though most of them are, that take a very cruel turn. And the LGBTQ community has been a target of many forms of bullying in school and out of school for centuries, probably. And one thing we need to be aware is that one of the things that all youth are going through is establishing their identity. And establishing or questioning the sexuality is part of the thoughts that go across the minds of all youth at this time. Those who identify with the LGBTQ community will probably be targets of bullying and effectively, just like the person making the question, stating the question said. Those are two issues that need to be addressed parallel, one to the other. And we cannot focus only on bullying, but we also need to focus on the development of the sexual identity of these individuals if they are target of bullying because of that. So yes, I think there should be some very particular issues to be considered in that case.
I would like to add to that, Javier, that also if we're dealing with a person from the LGBT community who's being bullied, I would want to assess what is the position of the family regarding their sexual orientation. Because if you have a teenager who is being bullied because of his or her sexual orientation, and on top of that, they're having to struggle with their own family members about it, then you really have a high risk of self-harm behavior and very, very dangerous things that could be happening there. So one way to begin to work with that is to first do an assessment of what's the situation of that teenager as far as their family members, as far as how they're dealing with their sexual orientation in his or her family, and from there also start addressing the problem. Because my guess is that if they have the support of their family members, they're going to be much more able to deal with that, bullying, to put boundaries and defend themselves. But if they're carrying with that shame or that secret because they're having to hide it from their family members, and they feel, or there's religious aspects or even cultural aspects that are negative in this way, then we really have a risky situation, and it's going to be much more difficult for that teenager to put an end to that type of abuse from the part of the bullying.
Okay, perfect. I want to thank once again everybody for being here today. Remember that if you want a copy of the presentation, you have it on handouts. So you can just click that box and you can download the handout for today. And if you miss some part of the webinar, you can also check our YouTube channel where it will be available. So that will be all for now, and we hope you have a great day. Thanks for participating.